We'll go. So here's our application kit, the normal application, all the things that accompany it. This is off of iPipeline again, that does the same coding engine that we had talked about running the illustrations when we walked through it. So iPipeline's really smart. They are able to highlight the pages of the application kit that are required no matter what. So the agent, it's pretty, dummy proof what they need to get completed. But, there's always situations that certain forms are needed based on travel, or if it's going to be a trust, or if they do any type of hazardous activity or anything like that. So in the application kit, here's the kit. Make sure we've got here. It might even stay in here. But anyways, here's the application, the normal stuff that, you will or you have been seeing. And then right here, this is considered the non-medical. Everybody calls it something different. American General calls it the Part 2. So you will see carriers will either call it a Part B, a non-med, or a Part 2, okay? And basically, this is the same, almost the same information as what a paramed examiner was going to do. So what they do is, if we're going to use that American General exam in those labs, which is fine, but the insured, normally you would see they don't complete this because they know that they have an exam. Some insured or some agents do have their insureds completed. Remember how we were talking about Tuesday being proactive and being able for the agent to get as much medical evidence up front as possible so it can be determined if any APSs are needed ahead of time instead of waiting for that exam to come across your desk. So this is, you'll see, the questions somewhat look familiar. Same thing, the insured would complete this, okay? So instead of him or her being examined again and doing a blood and urine, that's how we get around this. Now, this rule only applies to a few scenarios, and one of them would be if you're using another carrier's exam, okay? So don't get in the habit of thinking, oh, we can just get this non-med completed and blood and urine, and we're set if a paramed is needed. That's not the case. The carrier is willing to pay for a paramed exam, and everyone does understand that the carriers are the ones that ultimately pay for all these tests. The APSs, the medical records, the exams, somebody's going to pay for them, and it's the carrier that winds up paying for them. They get the bill. And so they're willing to pay to have, the paramed exam done and the blood and urine and all the costs that are involved in getting it tested and transmitted and all the things that it takes and all the people involved that we've talked about to be able to determine if they want to take that risk for that particular insured if they have any type of medical issues, okay? So what they'll do is, instead of putting that American General exam in the policy, they'll put this non-medical in the policy, okay? And that will take care of the issue of, of having the insured having to be examined again, because nobody wants to go through that again. So let's see, I had something on the tip of my tongue I wanted to tell you guys too. I'm trying to think. One thing that you will also get asked, I get it asked all the time still. My client, if I'm the agent, my client just had a full physical exam done, by their doctor, by their private MD. Can't I just use that as the exam? And the answer is no, you cannot. Reason being is they don't do the same testing and everything. I mean, an insurance exam is a little bit different than your physical that you go to your doctor, but most importantly, it's the blood and urine. Your doctor is not going to test you for drugs or for nicotine in your urine. They're just not going to do that. So that's why it's important to have the paramedical examiner do it or have the insurance exam, whoever is doing it, not the doctor. Okay? And it used to be in the old days that you could have a kit sent to the doctor of, the patient, and you'd have to set up an examiner to witness it while the exam's being put in, or the blood and urine is being put into the FedEx envelopes and all that. I think most of the carriers that I deal with now, they don't want any part of that. They've just found that it hasn't been a good turnout as far as good results or anything in that such, and they just want they can't just trust the doctors. The paramedics work for the insurance companies. So it just got to be too much of a problem than what it was worth. So so the paramedics now, they just do the specific, and they have their own guidelines as far as what they need to complete, as far as what, each carrier is different. Don't think everybody tests for the same thing. In general, they all test for the same thing, but there might be a couple other things like that Pro-BNP that we talked about that might be required. So, but in general, the carriers, they all ask for the same thing and get the same things done. It's basically whose paper it's on. Okay? But I can guarantee you are going to get asked if, your client that just had an exam done with their doctor, if they could do that instead. And as soon as I tell them that your doctor doesn't test, for the nicotine and the drugs and all that, then they get it. They understand. Okay? Does that help?
Okay.
Anybody have any questions?
And Julie, I have a question. Is the non-medical history is regarding the pre-existing diseases or something related to that?
I'm sorry, what?
Is it relating to the pre-existing diseases or something?
The non-medical is used if the insured wants to use an exam that was done for another company.
Okay.
Does that help?
Yes.
Okay, good. That's where the scenario comes up. Okay? Okay, let me get signed on here. Hold on 1 second, guys. I have to use my friend's sign on for this particular. We're going to walk through here doing an insurance exam.